Hi everyone, my name is Jacob, and this is the Tuskegee Syphilis Study, Lessons in Ethics, Law, Healthcare Policy, and Cultural Competency. Welcome to this training on the Tuskegee study of syphilis, a significant case in the history of healthcare ethics, law, policy, and cultural competency. Today, we will explore the background of the study, its ethical and legal violations, and the lasting impact that it has had on healthcare practices and society as a whole. This training aims to deepen our understanding and to help us avoid repeating past mistakes. An introduction to the Tuskegee Syphilis Study. The Tuskegee Syphilis Study was conducted by the United States Public Health Service from 1932 until 1972. It involved 600 black men in the state of Alabama, many of whom were misled about their health status and denied treatment for syphilis even after penicillin became widely available in the 1940s. This study serves as an important reminder of how vulnerable populations can be exploited in medical research, and also why ethical protections are critical. Throughout this presentation, we will examine the lessons learned from Tuskegee in order to improve healthcare delivery today and for the foreseeable future. Background of the Tuskegee study. The study's stated goal was to observe the natural progression of untreated syphilis. However, the participants were never given informed consent. They were told that they were receiving treatment for quote-unquote bad blood, which was a local term used to describe several ailments at the time. Even after penicillin was recognized as an effective cure in 1947, researchers withheld treatment to continue their observations. Alan Brandt's work reveals how the study was enabled by racial bias and scientific racism, which allowed these ethical violations to continue unchecked for 40 years. Ethical issues with the study. Several major ethical principles were violated during the Tuskegee study. Participants were denied autonomy through lack of informed consent, and they were deliberately deceived. The researchers exploited a marginalized group, betraying the principle of beneficence, which requires acting in the patient's best interest. Privacy and confidentiality were also compromised, as men were subjected to medical procedures without full understanding or agreement. Brandt highlights that these violations were rooted in systemic racism that shaped the medical community's actions at that point in history. Legal issues and policy responses. At the time of the study, there were few legal protections in place for research participants. It wasn't until the study was exposed in 1972 that public outrage led to legal action, including class action lawsuits and a presidential apology by Bill Clinton in 1997. The fallout from Tuskegee led directly to the creation of the Belmont Report and the establishment of institutional review boards, or IRBs, which now oversee human subject research to ensure informed consent, privacy, and participant safety. These legal and policy changes transformed how clinical research is conducted here in the United States. Impact on healthcare policy. The Tuskegee study prompted federal agencies to develop regulations protecting human subjects. These policies prioritize transparency, accountability, and respect for research participants. Protecting vulnerable populations became a key focus, ensuring no group is exploited again. Today, these policies guide ethical review processes and influence healthcare practices across the nation, emphasizing patient rights and equitable treatment. Cultural competency and societal impact. The legacy of Tuskegee has had a profound impact on African American communities, fostering deep mistrust toward healthcare and public health institutions. Studies by Thomas and Quinn show how this mistrust continues to affect willingness to participate in research and even to seek routine medical care. This mistrust complicates public health efforts such as vaccine campaigns and HIV education, making cultural competency, which is the understanding and respecting of patients' backgrounds and concerns, essential for all healthcare workers. Ethical and legal principles to mitigate risk. Today, several key ethical principles guide research and healthcare practice. The Belmont Report outlines respect for persons, beneficence, and justice, ensuring informed consent and fair treatment. The Health Insurance Portability and Accountability Act, or HIPAA, protects patient privacy and confidentiality. Institutional review boards review research proposals to identify and mitigate risks to participants. These safeguards exist largely because of Tuskegee's abuses and help maintain trust in our healthcare systems. Recommendations for healthcare professionals. Healthcare professionals must prioritize ethical, transparent communication with patients, especially when working with historically marginalized communities. Training on implicit bias and cultural competency is vital to rebuild trust and provide respectful care. Engaging community leaders and stakeholders can improve outreach and education efforts. By promoting transparency and accountability, healthcare providers can help heal the wounds left by Tuskegee and ensure similar ethical violations never occur again. Conclusion. In conclusion, the Tuskegee syphilis study stands as a grave example of medical and ethical failure that is rooted in racism and exploitation. It fundamentally reshaped laws, policies, and ethical standards that govern human research and healthcare. The study's legacy reminds us to remain vigilant in our efforts to protect patient rights, practice cultural competency, and uphold justice in all healthcare settings. Thank you for your attention, and let us commit to applying these lessons in our daily work to ensure equitable and ethical care for all.